Welcome. You are listening to the Learn, Identify, Fight Trafficking CME training, or as we call it, LIFT. This training is brought to you by the Physicians Against the Trafficking of Humans, an initiative of the American Medical Women's Association. Today, you will be hearing from several anti-trafficking advocates, including physicians and survivors. The mission of the Physicians Against the Trafficking of Humans, or AMWA-PATH, is to increase awareness of human trafficking, to utilize patient-centered approaches to identifying victims, to encourage trauma-informed care, to equip healthcare professionals to intervene on behalf of trafficked patients, and to provide medical professionals with connections to community resources.
Who we are. Our faculty and student PATH co-chairs are all volunteers, and all donations go toward promoting education and towards supporting survivor leadership in anti-trafficking efforts. Where we've been. AMWA-PATH leaders have traveled to many states and medical institutions to spread awareness and connect medical professionals with their local resources. Each audience is diverse, with healthcare professionals from a variety of fields and levels of training. We hope that no matter what field you are practicing in or level of experience, the LIFT training will provide you with new information that you can apply in your local hospital or clinic.
Before we formally begin our LIFT training, here's a brief overview. We'll discuss definitions of human trafficking, who is affected, where trafficking occurs, how our patients may be controlled and manipulated by traffickers, and why we should care about human trafficking as it relates to healthcare. Human trafficking is a complex issue that affects millions of people globally. While this presentation aims to provide up-to-date, relevant information, we recognize that human trafficking is a rapidly changing and evolving field. If you leave the course with questions or concerns, please send us an email at lift@amwa-doc.org. Throughout the LIFT training, our objectives are for you, the participant, to gain a better understanding of the scope and prevalence of human trafficking within the United States, to be able to recognize the warning signs of trafficking, to commit to screening for human trafficking for patients at risk, and to clinically evaluate and intervene on behalf of patients suspected of trafficking.
We learn in training that a patient's history and physical provide the clues to diagnosis, so let's start with a patient history. Your patient is a 21-year-old Caucasian woman who presents at 39 weeks gestation with her first pregnancy. She presents with ruptured membranes and contracting every 3 minutes. She has had no prenatal care and her fetus is in breech position. You rush to take her to the delivery room, to the operating room, and while inserting the Foley catheter, the nurse notices a tattoo of a 12-inch ruler on the patient's thigh. You find the tattoo unusual, but you rapidly complete the C-section and bring the patient to the recovery room. During a lull on labor and delivery that evening, you go back to ask your patient about the tattoo, and she tells you it's so that a man could measure his penis. This true story shows us that observation, curiosity, and follow-through can illuminate much of the unspoken story. Patients rarely will divulge that they're being trafficked. Instead, context and diligent awareness to important clues can help inform the medical team of the true picture. We'll discuss these clues a bit later in the training.
What is human trafficking? In this section, we will cover the legal definitions and various types of human trafficking. As you will see, the laws that define trafficking are dynamic and have changed over the past decade. With these changes comes debate about the ethical ambiguities of mandated reporting.
Throughout the LIFT training, you will hear real quotes from survivors of human trafficking. One such survivor, Sarah, shares, "I didn't really see myself as a sex trafficking victim until I was 20 or 21. I didn't really realize because I was working on the street. You really feel more like a criminal than you do a victim."
So what is human trafficking? In the U.S., human trafficking was first defined by the Trafficking Victims Protection Act of 2000, which made human trafficking a federal crime. In the nearly 2 decades since, the Trafficking Victims Protection Act, or TVPA, has been reauthorized 4 times. It is the cornerstone of federal U.S. anti-human trafficking laws. This law defines human trafficking as the recruitment, harboring, transportation, provision, obtaining, patronizing, or soliciting of a person for the purpose of a commercial sex act or for labor or services in which the labor, services, or commercial sex act is induced by force, fraud, or coercion. In the case of human sex trafficking, if the person has not obtained 18 years of age, then force, fraud, or coercion need not be proved. This is because under U.S. law, a minor under the age of 18 years old is deemed not old enough to consent to a commercial sex act at all. The United Nations has presented definitions of trafficking as well as in-depth analysis to the different components that lead to human trafficking. The UN Office of Drugs and Crimes outlines the 3 elements of trafficking: the act, means, and purpose of the crime. Under the international definition of the UN, force, fraud, or coercion need never be proved for human trafficking of any kind if they appear to be present. Although transportation is one of the many elements within the act, it is not required to be considered human trafficking. In this way, trafficking is a bit of a misnomer because movement of the victim is not necessary in the definition of the crime. And again, according to the U.S. law, if someone is under the age of 18 years old, the means can be eliminated. Regardless of many means used, an act for an explicit sexually exploitative purpose is considered human trafficking for anyone under 18 years old. This does not hold true for labor trafficking, where force, fraud, or coercion must always be proved regardless of age. In addition to the individual traffickers, perhaps we should all think about whether there is social coercion for certain individuals to engage in commercial sex. By criminalizing, marginalizing, or removing the option of legal work for certain individuals, we as a society are coercing individuals into sexual exploitation. This, of course, is not part of the definition of trafficking, but our survivors often tell us that the social coercion was as powerful as threats from their trafficker. The terms trafficking and smuggling are not interchangeable. These are different and distinct criminal activities. Human trafficking centers on exploitation of a person, while human smuggling centers on transportation and is generally defined as importation of people across international borders and involving deliberate evasion of immigration laws.
While Sarah and the survivor with the ruler tattoo both experienced sex trafficking, there are many other forms of trafficking. Labor trafficking is a major form of human trafficking and can be separated into several categories. All definitions are those provided by the U.S. Health and Human Services Department. Forced labor is the broadest category of labor trafficking, with traffickers taking advantage of gaps in the labor regulations or ignoring laws to exploit the physical labor of vulnerable workers. Labor trafficking has been documented in the restaurant industry, nail salons, illegal drug dealing, for example, those using drug mules, which are forced to carry illegal narcotics in dangerous ways inside their bodies, childcare, massage parlors, and even the healthcare industry. Bonded labor is a type of forced labor where the traffickers create or exploit an existing or fabricated debt that the victim has accrued. The trafficker uses the debt to manipulate the victim and prevent them from ever leaving. In addition, the trafficker may confiscate legal documents or even threaten the victim with deportation should he or she attempt to escape without paying their debt. In many cases, the debt is artificially increased through exorbitant charges for room and board or for daily necessities such as soap or even water. Bonded labor trafficking has been found in agriculture and landscaping companies as well. Involuntary domestic servitude is another type of forced labor that often occurs in private homes, with the victims working to clean, cook, and participate in childcare for the trafficker with no wages and no time off. Other types of trafficking, less common in the U.S., include the use of child soldiers who are forced to fight in wars that they are too young to understand. A less frequent but extremely exploitative form of human trafficking is for organs. Brokers exploit vulnerable persons to harvest any human organ, from kidneys to liver lobes to corneas and even hearts, and sell these organs on the black market, both in the U.S. and abroad. In forced marriage, women, especially underage women and girls, are forced to marry against their will, under duress and in the absence of free and informed consent. These are all different types of trafficking, but these are not an exhaustive list, as the Polaris Project identified over 25 different types of human trafficking in their Typology of Trafficking report. It is important to remember that many victims do not exclusively experience one form of trafficking. The Coalition to Abolish Slavery and Trafficking in Los Angeles, CAST LA, shared survivor survey results from 2017 demonstrating that trafficking trends can differ by age and can include both labor and sex trafficking. Additionally, trafficking victims and survivors are heterogeneous. While some may be trafficked only during childhood or their adulthood, others may be trafficked over several decades. These data represent just a small portion of human trafficking. Trends can differ geographically or by victim demographics.
To better understand the problem of human trafficking, we need to identify and understand the push and pull factors that lead to trafficking. Push factors are the socio-ecological factors that increase a person's vulnerability to trafficking. These include, for example, poverty, lack of education, history of abuse, war within one's home country, substance abuse disorder, and discrimination. Pull factors are the socio-ecological elements that increase a demand for trafficked or sex labor. These include wealth and disposable income, toxic masculinity, pimp culture, misogyny, industrialization and capitalism, and demand for cheap goods. To give you a better idea of the economics that drive human trafficking, the International Labor Organization estimated that human trafficking is a $150 billion per year industry worldwide. As referenced earlier, the laws that define trafficking are constantly evolving. On the federal level, the TVPA has been renewed over the last 2 decades. However, it is at the state level that the laws vary the most. Laws can shape everything from how sex trafficking is prosecuted to how recidivism and repeat criminal activity are addressed. There is a long history of debate between the legalization versus decriminalization of prostitution. Additionally, the role of mandatory reporting of minors who are trafficked has come under scrutiny. Finally, restitution to victims is a policy that still differs from state to state.
Healthcare professionals are considered mandated reporters of child abuse and neglect. It may seem an obvious conclusion that child trafficking falls under these regulations. The intended goal of the mandatory reporting laws are to connect patients who are the victims of abuse to needed resources, especially those patients who may not be able to advocate for themselves, as in the case of minors. The current national law that includes human trafficking within mandatory reporting laws is CAPTA, or Child Abuse Protection and Treatment Act. There have been various versions of this policy, and in the most recent version, trafficking has been included. At the state level, there are more variations and nuances to how trafficking should be reported and to which services. AMWA-PATH recommends that you look up your individual state laws on trafficking and mandatory reporting. Up-to-date information on this can be found at childwelfare.gov, and the address is listed at the bottom of this slide. On the other side of this debate about mandatory reporting are legal experts and anti-trafficking advocates who point out that the context in which one reports trafficking may impact the safety and the well-being of minors being trafficked. In her 2017 article, anti-trafficking expert Abigail English illuminates some difficulties with reporting trafficking against the will of the trafficked victims. When reporting trafficking against the wishes of the victim, the healthcare provider is violating the trust of the patient, potentially destroying trust in the medical establishment and decreasing the likelihood that the trafficked person will ever return for future health issues. Additionally, the systems in place for trafficked patients may not be ideal for the safety of the victim. For example, re-trafficking and abuse are common within the foster care system. In some cases, law enforcement may not understand the distinction between trafficking and prostitution, and the victim may be imprisoned for prostitution charges. In cases where the trafficked victim is not separated from the trafficker, retribution for the investigation may be fatal for the victim. In summary, the first question you need to ask your patient is, do you want me to report this? Will this help you? If the answer is no, then the next question for yourself should be, must I report this rather than can I report this? A lot of well-meaning healthcare providers are hoping to rescue patients and want to report, but they don't ask the patient first if she or he wants to involve law enforcement.
At this point, you may be asking, how common is human trafficking really? And how often do questions of mandated reporting actually occur? The prevalence and incidence of trafficking are difficult to capture, since trafficking is a covert crime with many cases going unreported and survivors and victims of trafficking not identifying as such. For those cases that have been recorded, trafficking is estimated to have affected over 40 million people internationally, as reported by the International Labor Organization in September of 2017. Within the United States, according to the U.S. State Department in 2013, 85% of the victims are U.S. citizens, with approximately half being trafficked as adults. That needs to be repeated because too often the media portrays trafficking as occurring to foreign-born women or very young girls, but 85% of victims are U.S. citizens and half are adults. This is consistent with the anecdotal experience of the PATH Leadership Board, but these statistics deviate wildly from the latest data and from the National Human Trafficking Resource Center, again highlighting the lack of reliability of accurate numbers. To stay up to date on the latest rates of trafficking and the international movements aimed at addressing these crimes, the Trafficking in Persons Report is an annual publication through the United States Department of Justice that sheds a light into the prevalence of trafficking, while the National Human Trafficking Resource Center provides up-to-date information on reported human trafficking within the U.S.
Mandatory reporting is not a black and white issue. While laws legally obligate healthcare providers to report cases of abuse and neglect, there may be instances in which providers question whether reporting against the patient's wishes is advisable. Ethical dilemmas may include cases in which an adolescent is almost 18 years old, the age of majority, or where the ethical principle of patient autonomy hangs in the balance. We also need to keep in mind the potential of retribution and violence directed toward the victim as he or she is attempting to leave. And in this case, the principle of first do no harm comes to mind. Some healthcare professionals hold to the belief that for the adult patient and even for the older adolescent, they are the best judge of when it's safe to leave and when it isn't. This training will not give you a definitive answer for every ambiguous situation you may encounter with a trafficked patient. Instead, we ask that you think critically about each patient encounter and weigh the implications and search for an established protocol before having a knee-jerk reaction to the case. Avoid the rescue fantasy of feeling that you must save the patient right now. Additionally, when mandated reporting may be necessary, alerting your adolescent patient to your obligation prior to asking probing questions is advisable. By alerting your patient to the obligation to report, you can help to bolster the sense of trust in the medical establishment and in you as a medical professional. Your disclaimer about the limits of confidentiality may impact what your patients disclose, but it can also help open the door to further conversations in the future. It empowers your patients and allows them to help guide the decision-making process based on their intimate knowledge of their trafficker and the risks at hand.
Where is human trafficking? You might still be questioning if trafficking happens where you live or if you may ever encounter a trafficked person. In this section, Lyft will address where trafficking occurs, especially what kinds of trafficking may occur and where.
Survivor Kathy shares, I was sleeping alone in East Los Angeles and feeling sick from heroin withdrawal when a man came up to me and said he wanted to help me. He gave me some heroin and told me that I could shower and rest at his house. I believe the man was in his 30s. He was well dressed and had a nice car. The man, of course, became Kathy's trafficker.
In this chart, using statistics from the International Labor Organization in 2017, we see that the modern rates of trafficking, including a large percentage of forced marriages and forced labor exploitation. Over 40 million men, women, and children are estimated to be trafficked or enslaved globally. For this next section, feel free to pause as you see fit. Now it's your turn to investigate trafficking rates. On your computer or smartphone, open a new browser window. Search for NHTRC trafficking statistics to find the National Human Trafficking Resource Center statistics on human trafficking for the U.S. Can you find how many cases of sex trafficking were reported to the trafficking hotline for the U.S. as a whole? What about labor trafficking? The data points listed are all collected from phone calls, texts, web forms, and emails about suspected trafficking cases to the National Human Trafficking Hotline and Be Free text line. Now look further into the results for the number of cases involving females. What about the number of children trafficked? Now try searching by state. Maybe start with your home state.
To give you an idea where all these cases of trafficking have been reported, this is a map compiled by the NHTRC. Areas in red have higher density of human trafficking cases reported. The top 3 states of reported trafficking cases historically have been California, New York, and Florida. You might notice that Dakotas have few hotspots. This is not because there is no trafficking cases, but that Indian territories are sovereign nations and have no legal obligations to report human trafficking, an issue that has touched upon the 2017 murder mystery film Wind River by Taylor Sheridan. To help illuminate how these trafficking hotspots are all connected, we overlay a map of the United States interstate highway system over the Polaris trafficking map. Now we see that many of the hotspots are located not only in ports and airports, but also along major highways.
Who is at risk? Who is at risk of becoming trafficked? This section not only describes those who are at risk of trafficking, but also those populations that are most frequently the buyers and traffickers.
Sarah says, I am a trafficking survivor. I was first trafficked when I was 13, and I got out of it when I was 21.
There are 3 main groups of people to discuss, and one group that is frequently overlooked. The first group is comprised of victim survivors. Here, it can be difficult to know which term best describes trafficked persons. The term victim is often applied to persons who are still in the life or are currently being trafficked. Survivor is commonly used to indicate someone whom is formerly trafficked, but is no longer presently trafficked. However, with our knowledge of recidivism or the high likelihood of becoming re-trafficked after escaping or leaving the life, we know that the process is not linear from victim to survivor, but there is more fluidity, and with some longtime survivors returning to life after previously escaping. We use the term victim survivor to help express this trend and to emphasize that even though a person might be currently trafficked, they are surviving on a day-to-day basis and in that way are also survivors. The second group are the traffickers, those who manipulate and coerce trafficked persons. There are many different types of trafficking relationships and no rules about who might be a trafficker or a buyer. Victim survivors of trafficking can become a trafficker in the future, perpetuating the cycle of trafficking. And finally, we will discuss the buyers in trafficking. One group we'll discuss much later in the training are the allies. Allies include truckers, flight attendants, hotel staff, and healthcare professionals who are training to learn more about human trafficking and who aim to assist and support victims of human trafficking on their path to freedom and healing. Allies, in other words, include us. Victim survivors of human trafficking may come from any place, socioeconomic class, and education level. However, through survivor-informed research, several groups are at an increased risk of becoming trafficked. These are just some of the groups that are at an increased risk. Note that a person can belong to one or more group and can have a compounded increased risk of trafficking. Those who have suffered forms of verbal and physical abuse previously are first among those at risk. Other groups include homeless and foster care youth. LGBTQ+ youth are at an increased risk as well, especially transgender people. Incarcerated persons are at an increased risk, and for sex trafficking, men and boys are often a forgotten group that are at risk and may not be reported as frequently because of cultural norms and fear of stigma. Trafficking can affect any and every race, religion, and ethnicity. Yes, the populations we mentioned are at high risk, but they do not account for all trafficked persons.
Homeless youth may be compelled to exchange sexual services for shelter, food, money, or drugs. The percentages listed on this slide represent those from a 2016 survey on 873 youth across 11 U.S. organizations serving homeless youth. 12% traded sex for protection while being homeless. LGBTQ plus youth may make up 20 to 40% of the homeless youth population. Because of discrimination, familial isolation or rejection, and other stressors associated with coming out in unwelcoming communities, many LGBTQ plus teens may be faced with leaving their homes in order to seek acceptance, reprieve from violence, or to secure gender-affirming hormone therapy. Many homeless teens have experienced adverse childhood events, or ACEs. ACEs may occur in a variety of forms, including abuse, neglect, or household dysfunction. These events can disrupt childhood social development and interfere with neurocognitive development as well. ACEs also increase the likelihood of developing complex type post-traumatic stress disorder, or PTSD. There are close links between child abuse and homeless youth. The Street Outreach Program reports that between 70 to 90% of homeless youth in their study had a history of childhood sexual abuse, and those individuals were 28 times more likely to be arrested for prostitution at some point in their lives. In one study, foster care and child welfare services were involved in 85% of trafficked teens. Specifically, LGBTQ plus youth experience more bullying, intimate partner violence, and discrimination within the health welfare system compared to heterosexual youth. These are all push factors for human trafficking.
For individuals incarcerated in the United States prison system, trafficking is a potential threat even while the individual is in prison. Traffickers have been found to utilize commissary accounts for recruitment, sending money or bail which the victim survivor then owes to the trafficker upon the release from prison. Traffickers will sometimes target incarcerated for prostitution or drug possession as easy targets for sex trafficking victimization. This practice was documented in June 2018 in The Guardian. Similarly, traffickers can use the threat of incarceration as a means of manipulating victim survivors. Traffickers may force drugs or victims may utilize drugs as coping mechanism. Both types of use put victims at risk for arrest. Additionally, victims may be forced to carry weapons illegally for protection against violent buyers. The victims may be forced to sell drugs on behalf of the traffickers. If the victim gets caught, guess who goes to jail for possession or dealing? Not the trafficker. In this vein, traffickers may force victims into petty crimes such as stealing or selling bogus magazine subscriptions. Finally, because prostitution is illegal in most areas of the United States, those forced into sex trafficking fear that the law enforcement may arrest them and prosecute them for prostitution regardless of their circumstances.
For sex trafficking, men and boys are a frequently under-identified group of victim survivors. Many shelters and resources available to other groups of survivors exclude male survivors. In 2014, the U.S. Department of Justice identified a significant number of male victims, both adults and children. In the same report, only 5% of shelter beds in trafficking recovery services were accessible to male survivors. Part of the reason boys and men are not readily identified within trafficking are due to the misconceptions of who may be a trafficking victim and a lack of screening for trafficked males. Cultural stigma also may prevent boys and men from speaking out for fear that they will be seen as weak or not manly, or because of their victimhood. Gender socialization makes it difficult for male survivors to speak out, as boys and men may be admonished, don't complain or be strong. Some may be told that because of their biological sex, they had a choice in being trafficked.
As mentioned previously, those who identify as LGBTQ+ may also be at higher risk of being trafficked. Some of the many reasons include family isolation and rejection, a higher prevalence of sexual violence within the family, intimate partner violence, self-blame, and confusion. Forced out by their family and communities, transactional sex may be an LGBTQ+ person's only means of providing basic needs for themselves. Specifically, within the transgender community, there's an additional financial burden due to the cost of gender-affirming hormone therapy, with medications often not covered by insurance. According to a report from Polaris Project, 20% of transgender individuals take part in an underground economy as a means of accessing limited resources for gender-affirming therapy. Additionally, transgender persons are at a higher risk for experiencing physical assault while participating in the other underground economy. This risk is higher still among racial minorities.
As survivor Nat Paul says, in order to fully respond to a potential victim of trafficking, one needs to constantly assess and weigh their own preconceived biases and assumptions as to what a victim looks like. Next, we look at what kind of relationships and identities traffickers may have. As this list demonstrates, traffickers can be any gender and have various relationships with the victim, including family members or boyfriends. Traffickers may be fellow survivors of trafficking who now perpetuate the cycle. Family members and religious leaders may be traffickers, using their close relationship and trust with the victim to leverage coercion. Gangs are increasingly using human trafficking in addition to trafficking drugs and guns. Gang members have learned that it is more profitable and less risky to traffic humans rather than guns or drugs.
Finally, looking at more common profiles of buyers or individuals who pay for trafficked persons. In sex trafficking, the buyer is referred to as a John. Many buyers are male, and often they are middle-aged, although the age range is quite wide. A majority have higher levels of education and are in a relationship. In addition, more than half have purchased sex services more than once a month. Some of the sexual acts that they pay for are violent or demeaning, and some of these buyers are paying for sex acts that they feel incapable of asking their intimate partner for. Who does this profile remind you of? White, male, middle-aged, highly educated, in a relationship, and pretty well off with disposable income to burn. Sounds like law enforcement or politicians or business professionals or lawyers, or this may sound to you like you or me or like our colleagues. Is it any wonder that when victims of human trafficking may not immediately trust medical professionals, we may look like their buyer or even their trafficker? It may cause victims to have mistrust or hesitation when interacting with healthcare professionals. We need to be aware of how our identity may impact our interaction with trafficked persons. Much of this information has come from excellent books, including Janice Raymond's Not a Choice, Not a Job, Exposing Myths about Prostitution and the Global Sex Trade, and Victor Mallaric's book, The Johns. As a reminder, all of the resources used to create this presentation are provided as a supplemental PDF. For those involved in other types of trafficking, buyers could be anyone, especially because the range of trafficking services are so wide. For example, labor trafficking may be taking place at our favorite restaurants, nail salons, or massage parlors. Furthermore, cases of domestic labor trafficking have involved law enforcement officers, powerful officials, and physicians as traffickers within the seclusion of their homes and offices.
How are humans trafficked? How exactly do traffickers manipulate victims, and how do people come to be trafficked?
Aisha observes, when people tell me that women choose this life, I can't help but laugh. Do they know how many women like me have tried to escape but have beaten black and blue when they are caught? To men who buy us, we are meat. To everyone else in society, we simply don't exist.
Recruitment into trafficking can happen anywhere using a variety of methods. Traffickers have been reported approaching potential victims at bus stops, in malls, using online social media platforms, and at schools. As a reminder, trafficking does not always include transportation of the victim across state lines or national borders. Some victims may live in their homes while being trafficked within the community.
2017 data from the Polaris Project demonstrates that the highest percentage of sex trafficking occurred in adolescents aged 14 to 17 years old, with those 18 to 21 years old closely following. Across all age groups, the use of romantic relationships and marriage proposals were the most common form of manipulation. Although sensationalized in numerous movies and television shows, abduction is one of the least common forms of recruitment, challenging many people's initial perception of what human trafficking looks like. Once recruited, there are a variety of methods that traffickers use to control victims. In the Polaris 2017 data, physical abuse was most commonly used method for controlling victims, followed closely by methods related to intimacy and relationship. Psychological coercion is also extremely prevalent, whether through threats and intimidation, economic abuse, or isolation.
The Duluth Power and Control Wheel is a visual representation adapted from the intimate partner violence research that demonstrates various means of controlling a trafficked person. Again, methods are not exclusively physical in nature, but include financial control, for example, keeping a victim's money, emotional abuse, intimidation, and isolation. One key article on methods of trafficking by anti-trafficking advocate Dr. Susie Baldwin compares trafficking methods to those used in prisoner of war integration techniques. One technique is the use of omnipresence, or the sense that the trafficker is always nearby, and occasionally indulgences such as gifting high-end items. As we know from studies in psychology, a system of unpredictable positive reinforcement or reward is extremely effective in shaping and manipulating a behavior or response. In other words, coupling affection with isolation or even violence can be very effective for controlling a person. In terms of push and pull factors, data from the Polaris Project show that many survivors of human trafficking report histories of poverty, homelessness, LGBTQ+ status, substance use, abuse, mental health issues, and child welfare system or juvenile justice system involvement. As we just discussed, occasional indulgences and financial control can be powerful means of controlling and keeping trafficking victims in this cycle of violence and need.
Now that we understand some of the factors that make people vulnerable to trafficking and the techniques that traffickers employ to control their victims, let's take a look at how these individuals are being sold and purchased on a day-to-day basis. Increasingly, trafficking in persons includes using websites such as the former website Backpage.com. Backpage.com was just one site where traffickers could advertise people, including children, for sale for sex. Traffickers would use coded words and emojis to advertise their victims' demographics to potential buyers and arrange for meetings. And they did this in ways that sought to elude FBI agents actively trying to identify trafficking rings. In a fascinating study out of San Diego State University in 2017, Information Systems Master's Program graduate Jessica Whitney decoded the online language of traffickers. In the case of Backpage, the CEO Carl Ferrer in 2018 actually pled guilty to charges of money laundering and conspiracy to facilitate prostitution. In other words, they devised instructions for pimps and traffickers to follow to create advertisements that would elude FBI detection. Backpage was subsequently shut down. Other recent legal actions have come against Backpage and all online companies. The Fight Online Sex Trafficking Act and Stop Enabling Sex Traffickers Act, or FOSTA-SESTA for short, are both celebrity-endorsed legislation that force companies to be held accountable for any trafficking that is facilitated through their websites. However, these bills were not without controversy among trafficking advocates. Many argue that adults who use these sites of their own volition to sell sex were now being forced back out on the street into dangerous situations, or alternatively to other more nefarious websites where they could not screen customers effectively. There's a great deal of misunderstanding about the scope and the limits of FOSTA SESTA. So what are these other nefarious websites? Backpage.com was not the only website with a personal section that advertised people and children for sale. The dark web or dark net is home to many websites that deal in black market commodities, from guns to narcotics and other illegal drugs to, that's right, people. Websites such as Alphabay and Hansa and the Black Death Group function by using untraceable IP addresses accessed through something called Tor, a downloadable browser. Once on the dark web, buyers may use Bitcoin or other digital currency to purchase drugs or people. Alphabay was just one such site and was shut down by Interpol in 2017 after raking in $1 billion in profits. Because of the untraceable IP addresses and untraceable currency used to make purchases, identifying traffickers and purchases and prosecuting these people is problematic for law enforcement officials.
Digging into the controversy between FOSTA and SESTA, let's look at the pros and cons of the legislation. Among the pros, the legislation targets known websites, such as Backpage.com, to help make trafficking on that website harder or impossible. It forces tech companies to develop surveillance methods for detecting human trafficking, thereby holding websites more accountable for finding trafficking and putting a stop to it. The legislation is based on the assumption that no form of sex work is safe. Among the cons is the problematic language of the law, which puts the burden on survivors to provide proof of trafficking conducted on the webpage. Additionally, as we mentioned before, some adult sex workers state that it limits their agency to select safe clientele. Given the existence of the dark web and non-US based websites not beholden to FOSTA SESTA, the legislation also does not eliminate human trafficking online, and in fact, it may make it more difficult for law enforcement to track down known traffickers or that might be using newer or exclusive sites. While Backpage.com was a known site for traffickers, it is also known to law enforcement, and it was utilized for tracking, identifying, and prosecuting traffickers. Among the cons is the problematic language of the law, which puts the burden on survivors to provide proof of trafficking conducted on the web page. Additionally, as we mentioned before, some adult sex workers state that it limits their agency to select safe clientele. Given the existence of the dark web and non-US based sites not beholden to FOSTA and SESTA, the legislation also does not eliminate trafficking online. And in fact, it might make it more difficult for law enforcement to track down traffickers on newer and more exclusive sites. While Backpage.com was a known site for traffickers, it was also a known site for law enforcement, and it was utilized for tracking, identifying, and prosecuting traffickers.
This controversy also reflects a larger debate on the topic of sex work among adults. On one side, there is a movement to legalize adult sex work, and those who advocate for legal forms of prostitution assert that this will increase regulations to ensure the safety of sex workers. Current laws are seen as systems that create oppressive labor conditions and encourage individual and systemic violence. The primary goal of those advocating for sex work legalization is to create a system where sex workers can earn a living wage without the fear of incarceration, forcing them to endure sexual and physical violence.
Trafficking in healthcare. Next, we will review where trafficked persons might interact with healthcare professionals and which health professional groups have taken a stand against trafficking.
Sarah observes, I think doctors have a certain idea of what a trafficking victim is. They think it's usually somebody who's a minority or somebody who's from another country or somebody who has no family or who's in foster care. So it didn't really even enter their mind, even as I was more open. Sarah is a white Orthodox Jewish girl who was trafficked within her own community while living at home and going to school for 8 years.
Trafficked persons may come to any number of specialists or primary care practices. Demographics of the victims can impact whether or not they have much access to healthcare, with numbers in different survivor-based studies varying widely from 25% to 88%. Trafficked persons are seen in emergent, inpatient, and outpatient settings. One 2016 study found that 58% of healthcare visits by trafficked persons were in emergency departments or urgent care centers, with 44% occurring in primary care clinics. OBGYN offices made up another 26%, and dentists the other 27%. Can you think of why a victim of trafficking might visit the dentist? Some traffickers inflict punishment by pulling teeth, a punishment that is extremely painful, but it's not as visible as an ugly bruise or a burn on the skin, and therefore does not deprecate the value of their product. Dental hygienists and dentists have the skills to offer forensic services involving the collection of evidence of signs of abuse, the patient's medical history and background, and even estimating the age of patients who lack a birth certificate. During a dental exam, injuries and findings should be documented thoroughly, along with likely cause. When considering the contact that trafficked persons have with healthcare, their interaction is limited to not only healthcare providers, but those ancillary staff who have also patient interactions, leaving lasting impressions on victim survivors. Trauma-informed care needs to be practiced by all staff members, not only those who are in the primary health decision-making process.
Healthcare providers can make contact with trafficked persons in other settings beyond the clinic or hospital, while specialists in healthcare settings such as psychiatric or adolescent medicine clients may come in contact with and help identifying trafficked persons. There are many other settings where health staff may come into initial contact with trafficked persons. Nurses, mental health professionals, physicians, and other providers may encounter trafficked persons in schools, clinics, homeless and abuse shelters, and Planned Parenthood, to name a few examples. Do not let trafficked persons go unnoticed because of non-traditional clinical encounters.
Since 2010, there have been a large number of professional health organizations that have made official statements against trafficking and advocated for improved health professional response to the issue. Here is a list of a few. Each organization has made its own comment and has taken a small or significant step to educating its members about trafficking in healthcare. Consider reaching out to your organization and inquire about field-specific efforts to bolster the anti-trafficking movement.
The impact. Let's now discuss the effects of trafficking on individuals and how trafficking can impact the livelihood of survivors well beyond their trafficking.
Great. And then
Survivor Leah said they were lied to. They were told that they were going to have a better life, that they were going to get everything they wanted, dresses, money, shoes, and they ended up having sex for $40.
One's trauma reactions depend on a variety of factors, including age, gender, life experience, culture, religious beliefs, support systems, and more. Individuals experience trauma in different ways and different degrees, regardless of where it falls on the continuum. Trauma reactions generally become more severe as one moves up the arrow of this trauma continuum from the bottom left-hand corner to the top right-hand corner, with trauma symptoms becoming more and more pronounced and recovery services and support requiring more time. Here are some examples of the different types of trauma events. For a single impersonal trauma, an example would be 9/11. It happened once. It may not have happened directly to me, but as an individual, I may be able to talk with friends and maybe even need to talk with a therapist once or twice. For a single interpersonal trauma, I'm coming home and I get mugged. I don't know the person. It only happened once, but it happened to me, and I'm certainly going to be looking over my shoulder for a while and may even need medical attention or therapy. Multiple interpersonal single perpetrator trauma. This would be an example of domestic violence. It's personal, it happens over and over again by the same person, and the victim may actually die trying to leave. Certainly a lot of therapy and a lot of recovery is required. For multiple interpersonal, multiple perpetrator trauma, this refers to human trafficking. These people are sold multiple times to different people, night after night after night, or day after day after day, and these people may be physically or psychologically or sexually tormenting them. This occurs over and over and over. Trauma is experienced by everyone differently and can have a cumulative effect. Healthcare providers also may face forms of trauma with impersonal exposure to traumatic events. Importantly, when we recognize the immense trauma that trafficking victims experience, we realize that as healthcare professionals, we cannot solve their trauma in a single visit.
We would like to take a moment to warn against the rescue fantasy, or the idea that it is vital to stop the trafficking at any cost, to feel the need to rescue the patient from the event. While it is an innate part of healthcare to do no harm, some situations may appear to have a blurred line as to what is harm or not. Reporting trafficking against the victim's wishes outside of mandated reporting, or empowering the victims and allowing him or her to choose when to report. When we recognize the complexity of the trauma our patient has endured, it will be easier for us to avoid the rescue fantasy and promote patient empowerment.
Trauma can impact not only the mental health of an individual, but also their physical health. Trauma can span a lifetime and can be cumulative. It can produce changes in neurobiology and adoption of health-first behaviors, for example, drug use, promiscuous sex habits, etc. As a coping mechanism, it can also result in early death.
Effects of stress and trauma can result in increased pain response, even in the absence of painful stimuli, which may not appear physically painful to a majority of patients, could explain pain for patients suffering from increased trauma. Note that it is important for physical exams. It is important to inform the patient of what to expect during a physical exam and to take care to notice signs of pain or discomfort.
Because of its importance, we mention again the words of survivor leader Rachel Lloyd, avoid the rescue fantasy. When we understand the effects of trauma on neurochemistry and cognition, we realize that we cannot fix these issues in a 15 or 30-minute visit, but we can restore humanity and control. With trauma-informed care, we can offer trust.
Revisiting adverse childhood events, or ACEs, and their connection to medical conditions, we see that many different pathologies are intensified by ACEs and trauma. Chronic pain, and especially chronic pelvic pain, can be worsened by trauma. ACEs and trauma can contribute to premature death.
Trafficking affects all spheres of an individual's life, including their psychological, biological, and social well-being. The impact may be subtle, but pervasive.
In 2008, leading anti-trafficking expert Dr. Kathy Zimmerman published a report that in a study of 192 female survivors of sex trafficking, there were high levels of abuse while being trafficked, and a majority of participants had PTSD. 39% had suicidal ideation within the previous 7 days, and 62% had memory difficulties. The physical effects of trafficking can include pregnancies, infections, burns, lacerations, and untreated chronic health conditions, just to name a few. It is important to screen for suicidal ideation and to remember that memory impairment can be a symptom and simultaneously impact one's ability to gather history of other symptoms.
Barriers to care. As all medical professionals can attest, there are barriers to care even with non-trafficked patients. Here we assess how access to care and patient identification can impact a victim's ability to reach health care.
Suleman, a survivor advocate and leader, says, when most people think of a victim of human trafficking, they often imagine the fear associated with interacting with law enforcement. What many experts in the field fail to understand is that those same fears exist when a victim of human trafficking interacts with the healthcare system.
Although some victim survivors have access to care, there are many that do not, and there are others who have care that is controlled by their trafficker. For example, sometimes the healthcare insurance may be in the trafficker's name, especially if the trafficker is a parent or guardian. Victim survivors may struggle with transportation issues, payment, insurance, and child care. Additionally, they may have ever-present monitoring by their trafficker and limited freedom of movement. Their access may be further disrupted due to trust of healthcare systems, either from false claims of trafficker who may say things like, they'll deport you if they find out, was simply a personal history of poor quality of care and discrimination by providers or staff.
Even when a victim survivor is able to gain access to care, there may be several obstacles that impact their likelihood of receiving quality care. With no or little training for medical personnel or support staff, there may be many trafficked persons who are simply missed in clinical settings due to a general lack of awareness. Negative stereotypes can also evoke pejorative language from staff who are not trained in trauma-informed care and can trigger re-traumatization, further impacting a patient's mental health. Additionally, a lack of decision-guiding protocols may make healthcare professionals uncomfortable with how to proceed should they find out that their patient is trafficked.
Sarah says, "When I was in the life, I never told any nurses or doctors. They didn't ask. I don't know if I would have ever told them if they had asked. Maybe. It depends on if I thought I could trust them. But I do think it's important to ask."
You may be wondering at this point, but what can I do about any of this? It can be frustrating as a professional knowing that you might have interacted with a trafficked person, but not having the tools to respond. While we cannot provide step-by-step instructions that are perfect for every scenario, we will attempt to provide an outline of common red flags for trafficking, some differences between signs of labor and sex trafficking, as well as how to proceed with a trauma-informed physical exam for a trafficked person.
The following few slides are signs to recognize during clinical encounters that may signal trafficking. However, it is noted that these are not absolute indicators. Taken by themselves in isolation, these signs are quite general. However, it is the whole picture and the context that matters.
During the history taken, an indication of unclear housing, inconsistencies in the patient's stories, or discrepancies between the patient's apparent age and their stated age can all be signs of trafficking. In addition, parents or clients that play exclusively in cash may indicate trafficking.
Some signs on physical exam can include untreated chronic conditions or worsened acute conditions for which the patient did not seek care sooner. Additionally, signs include sexually explicit tattoos, gang symbols, barcodes, vaginal lacerations, rectal injuries, and being malnourished. As we said before, patients may appear younger than their stated age.
Behavioral signs may be inappropriate dress for the weather, especially wearing short clothing during cooler weather. Also, fearful or submissive behavior, as well as lack of eye contact, may be a sign.
The items the patients use to bring to the appointment may also be indicators of a trafficking. Because of occasional indulgences as a means of manipulation, trafficked persons may have items that seem too expensive for their socioeconomic status. They may also carry 2 cell phones or become preoccupied with their phones during visit, potentially with traffickers on the other end who is listening to the entire appointment.
One of the most important behavioral signs may not be the patient's but your own. This is known as transference. If you suddenly find that you are talking with the patient and you feel anxious, scared, uncertain, confused, etc., it is likely that that patient feels these emotions and you are picking up on them. Notice this and try to ask about it.
Some overlapping signs of both labor and sex trafficking include untreated chronic conditions such as substance abuse, malnourishment, poor personal hygiene, or constant monitoring by one or more people. Also present may be PTSD symptoms as well as physical signs of abuse, including broken bones, bruising, burns, etc. Take a second to review this table and see how diverse the potential signs and symptoms may be. Not every trafficked patient will present with these findings, but these are the documented and more prevalent findings.
Right, so you identify a patient who is trafficked. What do you do next? When considering next steps, it is extremely helpful to find out if your local institution or healthcare center has an existing trafficking protocol. There may be a standard procedure in place to help you connect you and your patient with a social worker or an advocate who has extensive training on the topic or has resources available to aid in the care of the trafficked person.
When treating trafficked persons, it is vital to understand how the person may react. Victimization is learned behavior. Patients do not choose it. The reactions may differ from person to person, and their fear could manifest as violence and aggression towards the healthcare professional or meekness or appearing withdrawn. Restore control to your patients and empower them throughout the visit in order to dismantle distrust and fear. Be non-judgmental and empathetic.
A specifically tense part of the physical exam can be the GYN exam for patients. Here are some tips provided by the AMWA-PATH expert, Dr. Guy Ninsman, an OBGYN who established anti-trafficking clinics in New York and Chicago. She shares that communication is key. Always communicate what you are going to do before you do it. Be thoughtful about the language you use to describe the parts of the exam. Words like relax your butt, spread your knees, etc. are triggering. Be straightforward with your patient, and if you don't get a good sample, let them know, and see if the patient would like you to try again. If not, don't force the issue. A rapid exam is not always the best. A thorough exam is better. Also, allow the patient to insert the speculum themselves if that is more comfortable for them, similar to how they would insert a tampon. Use the smallest speculum possible and size up if needed. Always, always, always use and reapply lubricant, not water, before the speculum and the bimanual exam to minimize discomfort. A bimanual exam does not need to be done while standing in between the legs of the patient, which is the position of the power and domination. By moving to the patient's side, you can accomplish the same bimanual exam without triggering the patient by standing over her.
Here we review the PAIR tool developed by Dignity Health in Sacramento, California. PAIR stands for Privacy, Education, Ask, Respond, and Respect. And, as always, remember the National Human Trafficking Resource Center hotline, 888-3737-888.
The first and vital step, privacy, starts with where the patient interview takes place. Insist that the conversation related to trafficking is only in private, making sure all other persons are not in the room. When possible, avoid hallways or crowded, noisy places. Before beginning the conversation, make sure you tell the patient if you are a mandated reporter. If the patient is underage, inform them of your obligation to before starting the conversation. Give them the opportunity to choose whether or not to disclose. This empowers your patient and gives them the option to disclose if they feel that it is safe for them. While it may feel like you are not aiding, but rather harming your patient, you are instead building trust with them. Remember with privacy to also maintain patient and your safety. With the threat of immediate, direct interpersonal violence, do not hesitate to follow hospital or clinic security protocol.
For the third step, ask. Start with immediate needs such as safety, warmth, hunger. It may be difficult for patients to concentrate on broader questions when their immediate needs are not met. Here are a list of potential questions. Currently, there is a Health and Human Services screening tool that is available. It is not empirically tested, but it does contain questions to ask, specifically for adults. And it can be found on the Health and Human Services website. Search HHS, Human Trafficking Screening Tool, and click on the PDF.
An important note for when asking questions. Take care to avoid asking questions that are not necessary. There may be curiosity regarding their history or situation. However, do not ask questions that are not directly associated with the care of the patient or questions that might trigger traumatization.
At the final step and throughout the entire interview, respect the patient's autonomy and offer support. Be mindful of written resources as a possible cause for punishment by the trafficker later. Do not give an anti-trafficking handout that may signal to the trafficker that the patient is taking steps against them. This could lead to lethal retribution. Follow up whenever possible. Even for things that could be achieved over a phone, try to get the patient to return to the healthcare office for additional contact. While you do not want to follow up that is explicitly regarding trafficking, you can work with their chief complaint to follow up about blood work, urine screening, and other results in person. Finally, for resources, work with a social worker or other health team professional whenever possible. It can be difficult to stay up to date with resources available in your community, so work with others to know what contacts have changed and what services have been expanded.
This trafficking survivor asks, will I tell you about myself? Maybe, but maybe not. But if I know you care and you can offer help, maybe I can use that information down the line. Or maybe I tell my friend and she gets help.
The dilemma. Now we face what to do if you do get a disclosure from a trafficked person. As we've already mentioned, there are gray areas and some blurred lines about what actions are best.
There are several possible outcomes for a visit by a trafficked person, not all of which include straightforward disclosure. Regardless of the information divulged, always provide your patient with appropriate resources and safety for the forefront of every plan. Safety plans can be created with social workers and may or may not involve immediate contact with law enforcement. Remember again that safety for your patient and your staff and yourself is vital.
In case of a positive screening for trafficking, make sure to document history of abuse and medical findings. Be mindful of what chart access the trafficker may have. Example, are they the patient's HIPAA-approved contact? Can they log onto the chart online? Remember to consider this before openly documenting trafficking into the chart. Utilize trafficking ICD-10 codes when appropriate. This practice adds to body of knowledge regarding trafficking health conditions, can help with documentation and setting up resources later. Always refer your patient for appropriate treatment regardless of what resources you think they may have access to. Additionally, consider asylum referral for other medical legal services that are available.
In one of our final sections, we consider resilience, or the ability of the patient to recover as best as they can and seek wellness while living with the residual trauma of their trafficking. Like trauma, resilience is different for every person.
Adverse childhood experiences and toxic stress may be the largest public health issues of our generations. Prevent Childhood Abuse America describes resilience as the ability to thrive, adapt, and cope despite tough and stressful times. Resilience is a natural counterweight to adverse childhood experiences. A multifactorial response to trauma across multiple disciplines can influence an individual's likelihood of survivorship. Promoting resilience, increasing access to sustainable resources such as safe, sustainable, nurturing relationships and environments can all play a role in this patient's life, in addition to preventing intergenerational transmission of toxic stress. Above all, we can provide the patient with hope.
Please remember to practice trauma-informed care with your colleagues as well as with your patients. Change the question of "what's wrong with you" to "what happened to you" to create a trusting environment. Trauma-informed care is a system-wide approach to caring for people and is not limited to just healthcare, but other services as well. It is important to establish a supportive network with other services to promote hope, safety, and stable relationships and environments. While treating patients that are victims of human trafficking, providers are vulnerable to vicarious trauma. It's important to be aware of the impact that this may have on your emotional well-being. In order to reduce this effect, medical professionals should close the loop of conversation and follow up with other providers that are involved in caring for trafficked persons to create a unified front. This will help others notice signs of trauma and burnout in colleagues. Also, providers can discuss how to ensure appropriate documentation and develop a protocol that uses best practices in their institutions to have a standardized approach. Finally, it is crucial that we avoid the rescue fantasy. Patient autonomy and safety is our top priority, and some individuals are not interested in leaving the life. For reasons related to trauma, poverty, societal misogyny, and racism, there is a high rate of recidivism in the population as well. Instead of making it your goal to rescue trafficked persons, work with your local political and community leaders to combat poverty and discrimination daily.
Survivor advocate Christine Sessa says, with the assistance of survivor advocates, healthcare professionals feel empowered to identify patients, and patients know that they will be provided the care and assistance that they need.
Now we will discuss how patients can rebuild their lives outside of trafficking.
Survivors may require both immediate and long-term social services in order to leave the life. Additionally, many will have multifaceted legal needs as well. These services include safety planning, shelter or housing arrangements, clothing, personal needs, trauma-informed counseling, case management, economic empowerment with financial services, and family reunification if possible. These accommodations will help survivors establish themselves back into the community.
There are two types of legal remedies for immigrant survivors. One is the U visa. This is a visa designed for immigrant victims of specified crimes that occurred in the U.S., or for those immigrants who suffered substantial physical or mental abuse while in the U.S. Legal law enforcement must sign a statement that the victim is cooperating. Minors, however, are exempt from cooperating with law enforcement. The other type of visa is a T visa. This is for severe forms of trafficking that requires more cooperation with legal services. Victims must show that they would face extreme hardship involving unusual and severe harm if they return to their country.
Survivor Nicole says, my lawyers helped me to clear the convictions I had for prostitution and to get legal status. My counselor helped me realize I was just a kid when I was in the life, and luckily that I have a future to look forward to. I got help getting public benefits and in a job training program. It felt really empowering to see a whole team get behind me and support me. We thank you for your attendance and participation in the Learn, Identify, Fight Trafficking curriculum and hope that you will take the information that you learned to your respective communities to prevent and eliminate human trafficking.
What can you do to get involved beyond this LIFT training? There are many ways to make a difference at your own institution or clinics, including sharing this curriculum with other individuals. Furthermore, you can watch additional videos and view numerous resources at www.path-doc.org. Become an advocate in your community and the local government. Support legislation for mandatory training. Educate kids and healthcare providers. Write protocol using HEAL's Trafficking Protocol Toolkit. Join AMWA-PATH to receive our newsletter. And finally, donate to allow us to continue to offer free trainings on-site and online. There are endless ways to make a difference. Join us.